That was terrific, and it was a terrific paper, and I'm really very thrilled to be here. And I'm going to talk quickly because I've noticed all the speakers are talking quickly. So I guess I will too because there's a scary little clock here. So I want to begin by thanking the Retirement Research Consortium for organizing this meeting and for having this panel that bridges communities that don't often talk to each other. Because what I've observed being a health person is there's a health world and there's a retirement security world, and we don't often talk to each other, and this paper shows exactly why it's so important that we do. So the paper, as you've heard, looks at how much does out-of-pocket spending take as a share of Social Security income, and it shows pretty clearly that it takes a fairly big chunk, about 25%. I'm going to talk about some context, put the paper in, like, why does that matter? And then talk a little bit more about some questions and some observations about the paper. See, I can talk quickly too. So policy discussions of late have focused on non-retirees, as if that's a demographic group, right? We've been talking about the ACA and coverage and affordability there. But affordability for retirees will be an issue in the future. It's really only a question of when. Medicare costs are rising. This could come up in the context of the debt limit that should be coming up in September, may come up in budgets, it may come up anytime Congress revisits issues around deficits and debt. Issues around affordability are coming. It's just a matter of when they are coming. And really the crux of the issue is balance and who's going to pay. It's either going to be families and individuals, which was the topic of Melissa, Matt, and Sara's paper, or it's going to be budgets. And I put federal and state budgets here because it's federal for Medicare, it's states and federal for Medicaid. And we have seen how Medicaid is also facing serious budget pressures, and this could be an issue in the future. What I'm showing you here, because I want to start first on the federal side, is yes, Medicare costs are rising. They are rising in absolute terms. They're rising as a share of the economy. They are rising as a share of the federal federal budget. And so this is why I'm saying people are going to come back to this issue. But is the paper also, and before I go there, also, we know that more people are coming on Medicare, more people are coming on Medicaid as the population is aging, and when the population ages, this puts more costs onto the program. This shows you, and this is from recent work that we have done, that as you might expect, per capita spending is much higher for people as they get older under both of these programs. So as we hear about the aging of the population, it's not just the fact that more of us boomers are coming on. We're going to get old. We're going to have high expenses, and that's going to put pressure and result in some policy activity. But as the paper so aptly demonstrates, there really is an affordability issue that often gets lost in this discussion, so I'm thrilled that the paper went back and focused on it. I'm going to add a little bit to what Melissa said in terms of what's going on with Medicare that creates this affordability issue. There are gaps, and she's talked about some of the gaps. She actually didn't even mention all of the gaps that contribute to high out-of-pocket costs. There is no limit on out-of-pocket spending in Medicare, unlike virtually every other private insurance that we know of today, and that puts a burden on people who don't have supplemental coverage. There's actually no hard cap on the drug benefit, something people rarely focus on. We've talked a lot about closing of the donut hole, but we don't talk about the fact that once people with Sovaldi or other high drug costs have really high expenses and reach the catastrophic threshold, they continue to pay. A 5% coinsurance, and 5% of a big number is a big number, and that contributes to Melissa's out-of-pocket spending numbers that you've seen. There's no long-term care benefit, there's no eyeglasses, there's no hearing aids, there's very little dental, and all of that means that people on Medicare have fairly high out-of-pocket spending. What this means, and this is amplifying what Melissa also said, is that health expenses take a big chunk out of Medicare household budgets. We compared Medicare households with non-Medicare households, and you can see in this, the orange slice is bigger for people on Medicare, and people on Medicare also have other expenses, as Melissa says in her paper. Just because you're on Medicare doesn't mean you don't need transportation. You still have to pay your rent, you still have to pay for household repairs, you still have food and transportation costs. So this is an issue, even though sometimes in policy discussions people say, well, what's the big deal? Their kids aren't in school anymore. Of course it should be a big expense. There are other issues too. In prior work at the foundation, which Melissa acknowledged, we also have looked at out-of-pocket spending. And what you'll see, and this comes from the Medicare Current Beneficiary Survey, our numbers are a bit higher. And our numbers are a bit higher because we do include long-term care. And I think I was happy to hear that you're going to make some adjustments in the paper to look at long-term care, because when you do, what you see is the burden really is substantially higher at older age groups. And I think when you go back and you look at functional status, for example, you'll see that people in poor health who have functional problems also are paying a significantly higher amount out of pocket and more as a share of their Social Security income. And why does this matter? I don't know if Karen Smith is in the room, but we've been looking at income and assets of people on Medicare with Karen and the folks at Urban for quite a while. And what you can see here is that half of all people on Medicare have incomes of $26,000 or less. So when you think about these numbers, and I know that Melissa focused on Social Security, even if you look at total income, many people on Medicare really don't have a lot of excess money to spend. And we've also looked out at projections to the future. And if you look at the median doesn't rise very much. The growth is really at the higher income levels. So the typical Medicare beneficiary is going to face the problems that Melissa was talking about. There are going to be a number of policy proposals on the table. They already are on the table that could shift costs onto retirees, onto people on Medicare. They are not being actively talked about at this moment, but I would anticipate they would. And if they do, then people on Medicare will likely incur higher costs. Here I mentioned just a few: raising the age of eligibility, premium support, changes in benefits and cost sharing, restrictions in supplemental coverage, which could lower their premiums but raise other costs, more income relating of premium, which actually reminds me to raise a suggestion for you to be sure that you include income relating Part B and D premiums when you add that to the out-of-pocket side of the ledger. I also need to mention Medicaid, because if Medicaid is scaled back, that will also contribute to the costs of people who are on Medicare. 1 in 5 people on Medicare relies on Medicaid to help with supplemental insurance, so help with their premiums, help with their cost sharing, and help with other benefits that aren't covered by Medicare. So changes to Medicaid that end up scaling back benefits, if they do, will add to the burden in the future. So I'm so relieved I can speak a little slower now because I've made it to my last slide. So I really think this analysis makes a very important contribution, and I heard the other panelists, or the last panelist, say she was kind of jealous at this data set, because it really is a great opportunity to put together information on the out-of-pocket side and on the Social Security side. Because I haven't worked that much with the Health and Retirement Survey, I had some questions about how well it compares to the MCBS, because it is self-reported data, and we have, based on our focus groups and other work we've done, we've had some concerns with self-reported out-of-pocket spending data because people aren't so great at reporting that. And I know we're doing some comparisons in-house to look at, so for similar people, what do they say their premiums are, what do they say their out-of-pocket spending is, because we think that's important not to understate. And I know in the past there's been some differences between the two data sets. I was happy to hear you're adding long-term care, because I think that is a huge burden that needs to be included when you think about this. I would be really interested in seeing more by supplemental insurance and the premiums. I wasn't really surprised that people with supplemental private insurance have high premiums. I'd like to see the difference between Medigap, which is like $150, $200 a month, and 10 million people have Medigap policies, versus retiree health. We know employers are scaling back, so what are people paying? So I guess in wrapping up, what I want to say is it's a great paper, makes an enormous contribution. In some ways, the analysis, I would say, I think it may overstate the burden because it focuses on Social Security, and I would like to see it also look at income overall. We know income is higher than average Social Security, and so that's actually something we're trying to look at Kaiser also. but still seeing it as a share of Social Security is important. And as I said earlier, it also in some ways understates by not including long-term care, and I'm happy to hear you're addressing that. So thank you very much for this opportunity to comment on a great paper.